So today I just wanted to share a little bit about the differences between home health, palliative care, and hospice. And this is from my experience as a home health physical therapist. I've been doing this for about 7 years now. And so I have this conversation quite a bit with people. I've also been doing some consultations for a hospice company as well. So getting to know the hospice side a little bit more thoroughly. So, home health is a team of people that comes to see someone at home, typically after there's been a hospitalization or a change in condition, whether that's elective surgery or just an illness or a referral from their primary care for new symptoms. And what we do is we provide nursing care, physical therapy, occupational therapy, speech therapy. We have a social worker. Some companies have dietitians or other support services as well. Bath aid is another one, so a CNA that can help with bath assistance. So basically, home health, you need to be considered homebound. There are a few kind of insurance differences with some programs where you don't have to be homebound, but that typically means that it's very difficult for you to leave home, that you're not leaving home alone in most cases. You need a caregiver or equipment or things that need to be prepared in advance for you to leave home. And you're not typically leaving the home unless it's for a medical appointment or religious service or something else that's kind of a scheduled thing that you can't have done at home. So that's part of the qualification for home health. And then home health works on a 60-day period called a certification period. So that's about 8 to 9 weeks, kind of depending on where the dates fall when you get started. And that gives the team time to kind of see a person over a 2-month period and set goals and do reassessments and make changes as needed to work towards those goals. At the end of that 60 days, if everything's gone really smoothly, but there's still kind of goals that still need to be addressed, you can get authorized for another period of time called a certification period again. And depending on insurance, things are different. Even within the companies I work for, there's multiple insurance types that we see and different rules about how to get authorized for more. Or if someone's doing really well and they're done at 4, 5, 6 weeks, we of course can discharge as well. So that's kind of home health and the qualifications for that. Palliative care is a little bit differently. It can be in the home. I think there's also some outpatient as well. And that's considered more like chronic disease management, mostly nursing based from my understanding in my region. And so that's a lot to do with like people that have heart failure or COPD. And usually they're kind of checking in once a month or a couple times a month with a nurse or another palliative care provider and doing like medication changes, monitoring certain signs of disease progression, and just kind of having that team in the background available over a longer period of time. It's not as set of a structure as home health periods of time are. And then there's hospice care, which a lot of people get kind of panicky when that word comes up. They feel like that's us telling them that they're imminently passing away. So sometimes navigating that conversation can be a little bit of a challenge, but also the fact that I get to see my patients and build some rapport with them in their house kind of helps us have that conversation together. And so hospice is more of a condition that you're definitely, not your prognosis does not look like you're going to recover. And so then there's this team involved in working on quality of life. So whereas I'm a physical therapist in home health, I come in and say, hey, you're not able to walk and you want to be able to walk. Let's work towards that goal and let's use assistive devices or hands-on assistance, things like that to progress you towards walking on your own again, if that's possible. Hospice care would be more focused on safety and preventing decline, or at least setting you up with the tools you need as you do decline as far as mobility, medical conditions, things like that. And they have a team of doctors. A lot of times they'll have kind of an in-house doctor, so there's a little bit more responsiveness than some primary care clinics. So the orders, especially if status changes and meds need to change quickly, there's that kind of responsiveness there, which is nice. And then depending on the hospice company, they might have complementary therapies, so massage therapy, acupuncture. They have more of a religious portion to that as well. So usually a chaplain or other kind of spiritual advisors, whether the patient wants that or not, they can decide. But there's usually kind of more of that team involved in helping the patient and their families with this time that they're going through. So that's the differences. And the other thing for people to know that I end up talking to people about is that if you're on home health, usually you can still be working with your palliative care team because they might have been in place for a long time managing heart failure or diabetes or COPD, and maybe you need some therapy though. So we're able to come in and kind of come alongside that palliative team and work on therapy goals. Whereas with hospice, because of the goals of quality of life and changing from like rehab potential to more comfort care and managing symptoms, that prohibits home health being involved at the same time. So when someone we know is going to switch over to a hospice company, we do like a home health discharge and then they can get admitted to hospice care. So those are some of the differences. Those are some of the questions that I answer for my patients, and I would love to hear if you have any experience with home health or palliative care or hospice, and I hope that they were all positive ones.